A lot of people ask me questions about orthodontics, and can I just get braces and get this tooth fixed? And I always have to say, well, we have to look at the medical side of braces. The medical side of braces, in the word orthodontics, the first letter is O, and O is for oxygen. And every time we do orthodontics, we always have to make sure we end up with a patient having a better airway, having more oxygen. And so that means very often that before we do braces, you must think about widening the upper jaw. And we call the old style of braces where they pulled out teeth and put on braces. We call that small box orthodontics, or thinking small. And we talk about the newer concept of orthodontics. We talk about expanding and developing the airway and then doing braces after the teeth have lots of room to line up properly. And we try to avoid removing teeth. So braces and orthodontics are fitting together, but there's now phases. And the first phase is expand and develop the arches and maximize the airway, make sure the jaw joints are properly hung and relaxed, like you'd hang a door, make sure the hinges are hanging properly in your two jaw joints, and then line up the teeth properly. And you can line up teeth with braces, and there's braces that go on the outside, there's braces that are metal, there's braces that are clear, and there's braces that go on the inside. And you can start with braces to get the major movement of the teeth done, and then you can end up with just clear covers, like an invisible coating. And that Invisalign type concept can be used to finish off your case. So you might not be in braces for more than 6 months. So those are all the different methodologies, but today we're blending together. We're talking about the new blended form of orthodontics, in which oxygen is our priority, the airways, and then good muscles, good jaw joints, and then finally a good swallow, and then the teeth are a bonus. Straight teeth are the end result of well thought out orthodontics. So if you want more information, email us info@dolphindentistry.com or phone us 613 to learn more. Call 234 and 5758. Make a smile date.